Hello, I'm Dr. Francois Bethoux, and I am a physiatrist. Some people also say a physiatrist from Cleveland, Ohio. A physiatrist is a physician who specializes in physical medicine and rehabilitation and is really the leader of a rehabilitation team. And the role of the physiatrist in rehabilitation in general in the care of patients with primary progressive MS is to address issues related to function, how to maximize a person's ability to function, even considering all the limitations that are imposed on that person by their disease. And the physiatrist is always the leader of a team. That team may be in the same building, in the same office, but also could be in a different facility. But there's always a lot of coordination and communication that goes on between the physiatrist and other professionals, such as physical therapists, occupational therapists, speech-language pathologists, but also rehabilitation nurses, psychologists, and other professionals. The particular role of rehabilitation in the care of patients with primary progressive MS is very important. Many people with primary progressive MS feel a little left out because there are no approved treatments for this particular type of MS to treat the disease. But there are many treatments and interventions that can be carried out to enhance the function and quality of life of people with primary progressive MS. For example, there are some medications to treat symptoms such as weakness, spasticity, fatigue, and all of these symptoms can have an impact on function and quality of life. There are devices that can be used. Now, people with MS sometimes have a difficulty using devices because they think it's giving in to the disease. It's actually quite the opposite. It's actually a way to fight the disease better and to maximize function again and to get around the limitations imposed by the disease. Devices such as cane or walkers, but also splints and braces, and more recently electrical stimulation devices for foot drop. So with all these interventions, and of course exercise as well, which is very important and must be carried out almost on a daily basis, we can in many patients enhance the ability to function and the ability to enjoy life. And it's very important to start this approach very early in the course of the disease, sometimes as early as the time of diagnosis, so that behaviors and exercise routines can be set in place when it's easy to do them and they then become a habit. And through the course of the disease, the same exercises can still be helpful even if some limitations increase over time. If you would like more information about the role of the physiatrist in the care of patients with primary progressive MS, please contact the National MS Society.